Medical Matters with Dr. Vicky Skitter. Nice to have you with us again, Doctor.
Thank you, Jeremy. Nice to be
You
here.
said you wanted to come in today and talk about HIV prevention and that. Why specifically HIV and why specifically now?
Aren't you gatvol of COVID? I'm so gatvol.
No, I am. Yeah, I am.
But yeah, through this pandemic, there's so much emphasis on COVID, that things get left behind. Important things like cancer and even skin lesions and HIV prevention. I mean, we forget about those. They sort of, and it's important because we've also got an HIV epidemic.
Yes.
Fact is 1.7 million cases were globally found in 2020 only. That's a lot, eh? And in South Africa, 1,500 young women and girls get infected daily. So I wanted to refocus a bit on HIV, counselling and education, and just go over those little, one just have to think again, because we only think about mask on your face now. We don't think about mask on your goodies. Because you have to protect your goodies as well.
Like using condoms.
Exactly. So you've got female condoms, you've got male condoms, even male circumcision. We forget about that. That's been left behind in the past 2 years. That helps. And behavior of people, even something as simple as being faithful to your partner, or abstinence if you need to. Think about the police and the justice system, where rape cases come, focus on that a bit, protect the people. Harm reduction, so people that share needles, that even they must think about that, don't share needles. Simple things like that. Preventing mother-to-child transmission, and then you obviously get your ARTs, which is your antiretroviral treatment. You get your post-exposure prophylaxis and your pre-exposure prophylaxis. So there's a hell of a thing you can actually do, and people just forget about it.
How effective is the current antiretroviral treatment or treatments?
Very effective. And I mean, that's important for us to educate our patients. So almost 100% if you take it properly. So the whole aim is to treat your patient for about 6 months. It's usually about 6 months if they're on the right treatment and they do it properly. Then you should be, then the virus should be undetectable and then untransmittable. That's the whole thing. So you've got your primary treatment of your HIV positive patient with the ART, your normal treatment. But then we mustn't forget about those, the power of pre-exposure prophylaxis, the PEP, and the PrEP, the pre-exposure, the post-exposure prophylaxis and the pre-exposure prophylaxis. So to overcome an epidemic like HIV, one should actually, there's like a push and pull factor. So the push of the preventative measures and the pull of the treatment together, they should, much more powerful. This approach was used in San Francisco recently, and they found that there was a 51% reduction in HIV transmission, the push and the pull factors. So access to the ART has averted about 12 million deaths globally. That's impressive. And if you treat the patient, then secondarily you will also prevent transmission, because, as I said, that virus becomes undetectable. So it's important to teach our patients the U equals U concept. It's undetectable equals untransmittable. So